Dzień dobry everyone, my name is Catherine Kanina Charunita and I am a medical student from Universitas Airlangga, Indonesia. This video is about my unforgettable 1-month exchange program in Kraków, Poland, where I joined the surgery department at Szpital Uniwersytecki, Krakowie. It was a journey full of learning, culture, and friendship, a time I'll never forget. My first week, I finally stepped into the hospital and met my lovely tutor, Dr. Justinia. She introduced me to the department and I learned the basics, how to properly enter the surgical room, what to wear, how to change, and how to maintain a sterile environment. These small routines made me feel like part of the surgical team. After finishing our activities at the hospital, we usually had lunch together. The hospital provided us with free meals every day. One of the highlights of this week was our surgical class, designed to strengthen our understanding of surgical anatomy and technique before doing hands-on practice in the following weeks. In the second week, I started to follow more complex operations, including liver resection, where I learned how to identify liver segments, cholecystectomy, where I saw how surgeons manage the cystic duct and the artery before removing the gallbladder, gastric cancer exploratory laparotomy, where I learned how they evaluated metastasis, and skin grafting, where I observed how split thickness graft and negative pressure wound therapy were used to promote healing. Outside the hospital, we had one of the most memorable experiences of the exchange, the National Food and Drink Party. Everyone brought dishes from their home countries, and we from Indonesia proudly shared rendang, indomie, and brem. It was a joyful night filled with laughter, flavors, and friendship. By week 3, our doctor invited us to join her in the outpatient clinic, where we could observe and learn from simple procedures. I even got a chance to assist more closely and try some hands-on procedures like removing stitches and performing wound care for post-operative patients. Outside the hospital, we also had a wonderful cultural day learning to make pierogi, the famous Polish dumplings. We rolled the dough, made the filling, and cooked together. And this was my last week in the hospital, my last time changing into scrubs, and my last time stepping into the operating room. It felt bittersweet, knowing the exchange was coming to an end. In this final week, I was trusted to perform simple sutures for a benign skin cancer. Of course, under the close supervision of my doctor. She guided me carefully and was always ready to help whenever I needed support. To close our exchange, we traveled to Zakopane and hiked in the Tatra Mountains. That morning, the weather was cloudy and almost rainy, and we were a bit worried that the hike might be cancelled. But as we started walking, the sky slowly cleared. The trail was surrounded by green hills, tall pine trees, and mountain streams, creating such a peaceful atmosphere. When we finally reached the Tatra Lake, it was absolutely breathtaking. The water was calm and clear, reflecting the mountains around it. We sat by the lake, enjoying the fresh air and talking about our experiences, how much we had learned, grown, and bonded throughout the month. It felt like the perfect way to end our journey, just like the memories we carried home from Poland. And that's the story of my 1-month exchange in Kraków, Poland. From learning in the operating room to sharing food and traditions, I discovered that medicine is not only about treating patients, but also about empathy, respect, and collaboration. Thank you, Szpital Uniwersytecki Krakowie, and especially Dr. Justinia for your guidance and kindness. And thank you, Poland, for opening your doors and hearts to all of us. Dziękuję bardzo, Poland. See you again someday.